Hello, seniors. I am Dr. Robert Harrison. Listen carefully. What I'm about to tell you could save your life. Every time you go to the bathroom, your body is trying to communicate with you. Yet most people simply flush and walk away without a second thought. They have no idea their body may be screaming for help, and that mistake can be deadly. I know this sounds frightening, but I am Dr. Michael Kent, and I have seen this happen far too many times in my practice. People ignore the warning signs because they think what they're experiencing is normal. Then one day they're told they have cancer, and by that point, it's often too late to do anything about it. Here is the truth that almost nobody talks about. Your stool is like a report card for your body. It gives you valuable information about what is happening inside you. The color can tell you about your liver and pancreas, or whether you may be bleeding internally. The shape can warn you if something is blocking your intestines, even something as serious as a tumor. The most alarming part is that the most dangerous type of stool can look almost normal at first glance. You might look into the toilet and assume everything is fine while something life-threatening is quietly growing inside you. That brief, awkward moment when you glance into the toilet before flushing could genuinely save your life. Today, I want to show you exactly what to look for. I'll explain which types of stool are the most dangerous and when you need to run, not walk, to the emergency room. But my goal isn't just to scare you. I'm also going to give you practical, realistic solutions, simple steps you can start today to protect yourself. These are things that can help even if you're already taking medications, even if you have limited mobility, and even if you're living on a fixed income. The final two secrets I'll share are so powerful, they could significantly improve your health in just a few weeks. First, you need to understand something very important. Most people have no idea what healthy stool is supposed to look like. They were never taught. No one wants to talk about it because it feels embarrassing or unpleasant, so it gets ignored. That silence is a huge mistake. Let me explain this as simply as possible. Doctors use a tool called the Bristol stool chart. You can print it for free online and even tape it inside your bathroom cabinet. Just search for it and you'll find it easily. The chart categorizes stool from number 1 to number 7. Number 1 looks like hard little pellets, almost like rabbit droppings. Number 7 is completely liquid like water. What you should be aiming for is stool that is brown, soft, and well-formed, similar in shape to a sausage. It shouldn't be too hard or too loose, and it should pass smoothly without discomfort. When your stool looks like this, it usually means your digestive system is functioning properly. The brown color comes from bile, a substance produced by your liver. Bile starts out green, but as it moves through your digestive tract, it turns brown. That color change is a sign that things are working the way they should. You should also be having a bowel movement at least once a day or once every other day, ideally around the same time each day. If you're going much less often, or if you suddenly start going far more or far less than usual, that's a warning sign your body is giving you. This is where things start to get serious. Healthy stool should have a normal thickness, roughly about as thick as your thumb, maybe a bit wider. If you notice that your stool has become very thin, like a pencil or a flat ribbon, it could mean something is narrowing or squeezing your intestines. That pressure could be coming from a growth. And yes, that growth could be a tumor. I'm not saying this to scare you unnecessarily. I'm telling you because so many people simply don't know this. They see thin stool and assume they're just constipated, so they wait and hope it goes away. Meanwhile, if cancer is the cause, it continues to grow every single day. If you notice pencil-thin stool more than twice in 1 week, you should call your doctor's office the very next morning. Don't wait for your next routine appointment. Tell them you're experiencing changes in your bowel movements and need to be seen soon. Those words matter and they get attention. Now, I need to tell you about the most dangerous type of stool you can encounter. If your stool ever appears black, truly black, like tar or used coffee grounds, stop everything and treat this as an emergency. This type of stool usually means there is bleeding somewhere inside your digestive tract. Blood from the stomach or intestines turns black as it passes through your system. This could be caused by an ulcer, torn blood vessels, or cancer. The truly terrifying part is that if there is enough blood loss to turn your stool black, you may be losing a dangerous amount of blood and your life could be at risk. If you ever see black tar-like stool, call emergency services or go to the emergency room immediately. Do not wait until morning and do not wait to see if it happens again. This is as serious as chest pain. There is one important exception to mention. Certain medications such as iron supplements or Pepto-Bismol can also darken your stool. However, medication-related dark stool often looks grayish or dull, whereas blood-related stool looks shiny, sticky, and tar-like. If you're ever unsure, it's always safer to go to the hospital and get checked. Another danger sign to watch for is visible blood. If you see bright red blood in your stool, on the toilet paper, or in the toilet water, you need to pay attention. Sometimes this is caused by hemorrhoids and is not serious, but other times it can be due to polyp or cancer, and you cannot tell the difference just by looking. If you see a small amount of bright red blood once, you should call your doctor within the next few days. If you see blood more than once, or if there is a large amount, you should call your doctor the same day. If you see blood and also feel dizzy, weak, or unusually tired, that is an emergency and you should go to the hospital right away. Do not try to push through it or ignore it. Changes in how often you have bowel movements are also important. If you are constipated for more than 2 weeks, that needs medical attention. If you have diarrhea lasting more than 4 weeks, it could indicate a serious problem in your intestines, such as infection, inflammation, parasites, or cancer. Many people don't realize that common medications can also affect bowel movements. Blood pressure medications, painkillers, antidepressants, iron supplements, and calcium supplements can all cause constipation. If you started a new medication and then noticed constipation, you should tell your doctor. Sometimes a simple change in medication can solve the problem. Never stop taking a prescribed medication on your own, but always speak up about side effects. Now, I want to share 5 simple but powerful ways to protect yourself. The same advice I give my patients. The first is to move your body every day. When you sit for long periods, your intestines become sluggish. The good news is that you don't need intense exercise to help. Even gentle movement makes a difference. If you can walk, aim for 10 to 20 minutes a day, whether it's inside your home, around your yard, or in a shopping mall. If you use a cane or walker, that's perfectly fine. Just keep moving. If you can't walk, you can still stimulate your intestines by sitting in a chair and lifting your legs, marching in place, doing arm circles, or gently rocking side to side. The best time to do this is in the morning after breakfast, when your digestive system is naturally ready to work. The second secret is to stop eating junk food and start eating food that heals your gut. Highly processed foods like chips, cookies, frozen dinners, packaged snacks, hot dogs, and processed meats damage your intestines. Processed meats such as bacon, sausages, and deli meats have been scientifically linked to cancer. Many people assume healthy food is too expensive, but that simply isn't true. Bananas are inexpensive. Apples are affordable when in season. Oatmeal is cheap and lasts a long time. Carrots are one of the least expensive vegetables. Canned beans cost very little. Eggs are an affordable protein source. Brown rice is inexpensive. And frozen vegetables are just as nutritious as fresh ones. You don't need specialty or organic foods. You need real simple food that previous generations would recognize. A good rule to follow is this. If a food comes in a box or bag and has more than 5 ingredients you can't pronounce, avoid it. A simple budget-friendly meal plan might include oatmeal with banana and cinnamon for breakfast, or eggs with cooked vegetables. Lunch could be bean soup with carrots and onions, or a sandwich with real chicken or turkey and vegetables. Dinner could be baked chicken with brown rice and frozen vegetables, or fish with a baked potato and salad. Snacks can be fruit, carrots, or plain yogurt. Drink water with your meals. This way of eating often costs less than a diet full of processed foods, and your digestive system will function far better. The third secret is addressing parasites once a year. Many people assume they couldn't possibly have parasites, but millions do without knowing it. Parasites steal nutrients, cause fatigue, disrupt bowel movements, and can lead to serious illness. Treatment is usually inexpensive, safe, and involves only 1 or 2 doses of medication. You can ask your doctor about this during a routine visit. If you have pets, this becomes even more important because parasites can be transmitted from animals to humans. The fourth secret is getting a colonoscopy after age 50 or earlier if you have symptoms. Most people dread the idea, especially the preparation, but this test saves lives. Colon cancer often has no symptoms until it's advanced, and a colonoscopy can detect cancer early or remove precancerous polyps before they become dangerous. Medicare covers screening colonoscopies for those 65 and older at no cost, and most insurance plans cover them as well. If cost is a concern, hospitals often offer financial assistance. Fear should not stop you, and most patients say the preparation is worse than the procedure itself. The fifth and most important secret is taking care of your gut bacteria every day. Your intestines contain trillions of beneficial bacteria that help you digest food, fight disease, produce vitamins, and even regulate your mood and energy. When these bacteria are healthy, your whole body benefits. When they are damaged by antibiotics, poor diet, or illness, your health suffers. You can support them by eating foods with probiotics such as plain yogurt with live cultures and foods that act as prebiotics like bananas, apples with the skin, oatmeal, onions, garlic, beans, and whole grains. These foods are inexpensive and incredibly powerful. Starting today, I want you to look at your stool for just a few seconds before flushing. Keep a small notebook and jot down what you see. Is it brown, soft, and easy to pass? This simple habit can give your doctor valuable information if something changes. Ask yourself regularly whether your bowel movements are consistent and comfortable. If they are, you're likely on the right track. If you notice danger signs such as black stool, repeated blood, pencil-thin stool, long-lasting constipation, prolonged diarrhea, or any sudden change that lasts more than a week, take action and contact your doctor. Do not be embarrassed. This is what doctors are trained to discuss. When you call your doctor's office and feel your concern isn't being taken seriously, say that you're experiencing red flag symptoms and need to be seen sooner. That language matters. Your body communicates with you every day through your bowel movements. The real question is whether you're paying attention or ignoring the warnings. Start paying attention now, because early action can save your life. Your family needs you. You deserve to stay healthy, and your life may depend on listening to what your body is telling you. I'm Dr. Michael Kent, and I want you to take this seriously. Every small step you take today can have a massive impact on your health tomorrow. It's not just about preventing disease, it's about maintaining energy, vitality, and quality of life as you age. Your intestines are the core of your body's health. When they function well, everything else follows suit. Your immune system strengthens, your energy levels rise, your mood stabilizes, and your body can effectively absorb nutrients. Ignoring changes in your stool is like ignoring warning lights on your car. The longer you wait, the worse the problem becomes, and sometimes the repair becomes far more complicated or even impossible. Let's go deeper into understanding the subtle signs that your body may be giving you. Stool that is unusually pale, almost clay-colored, can indicate a lack of bile, which might signal liver or gallbladder issues. Greasy or floating stool that's foul-smelling could point to malabsorption problems often caused by conditions like pancreatitis or celiac disease. If your stool has mucus or is particularly sticky, it might indicate inflammation in the intestines, which could be related to infections, inflammatory bowel disease, or other gastrointestinal disorders. These are all warning signs your body gives you long before severe complications develop, which is why paying attention early can literally save your life. Consistency is key when monitoring your stool. Keep your notes consistent. Include the date, the appearance, color, and ease of passage. Over time, you will have a clear record to show your doctor, making it easier to identify abnormalities early. Think of it as preventive health insurance that costs nothing and takes less than a minute each day. If you have noticed subtle changes, slightly harder stools, mild color variations, occasional thinner segments, don't ignore them. Many people assume these are minor temporary issues, but small changes can be the earliest indicators of more serious conditions. Hydration plays a significant role in bowel health. Drinking enough water ensures your stool remains soft and passes smoothly, preventing constipation and reducing strain on your intestines. Dehydration can make your stool harder, darker, and more difficult to pass, which may mask other warning signs. Aim for at least 6 to 8 glasses of water daily, adjusting for activity level and climate. Avoid excessive caffeine and alcohol, as they can dehydrate your body and exacerbate intestinal issues. Dietary fiber is another essential factor. Soluble fiber found in oats, beans, apples, and carrots helps stool retain moisture, promoting smooth passage. Insoluble fiber present in whole grains, leafy vegetables, and nuts adds bulk and keeps your intestines active. Balancing both types of fiber supports regular bowel movements and reduces the risk of intestinal obstruction or irritation. Many people consume far too little fiber, which leads to chronic constipation, straining, and increased pressure in the intestinal walls, risk factors for hemorrhoids, diverticulosis, and other complications. Probiotics and prebiotics are crucial to maintain a healthy gut ecosystem. Good bacteria digest food, produce essential vitamins, and protect against harmful pathogens. When these bacteria are out of balance, the digestive system slows down, immunity decreases, and inflammation increases. Incorporate foods like plain yogurt, kefir, bananas, garlic, onions, and beans to support these beneficial microorganisms. Avoid unnecessary antibiotics, which disrupt this balance and leave your gut vulnerable to infections and poor nutrient absorption. Exercise, even gentle, supports gut motility and overall digestive health. It stimulates the muscles in the intestines, helping move stool through your system efficiently. Even light activities such as a 10-minute walk, stretching, or chair exercises triggers digestive activity, preventing stagnation and reducing the likelihood of constipation-related complications. Combining movement with mindful eating, adequate hydration, and a fiber-rich diet creates a holistic strategy for a healthy digestive system. Regular medical checkups and screenings are another critical aspect of prevention. Colonoscopies, for instance, are not just for detecting cancer. They also allow your doctor to identify and remove polyps before they become malignant. Other tests, like stool analysis, liver function tests, or imaging scans, may be necessary if warning signs appear. Being proactive rather than reactive significantly increases your chances of catching serious conditions early when they are most treatable. Let's talk about lifestyle habits that sabotage gut health. Processed foods, excessive sugar, and high-fat diets slow digestion, cause inflammation, and disrupt the gut microbiome. Smoking damages the intestinal lining, reduces blood flow, and impairs the immune system. Chronic stress triggers changes in gut motility, increases acid production, and can lead to irritable bowel syndrome or exacerbate existing conditions. Prioritizing whole foods, practicing stress management techniques like deep breathing or meditation, and eliminating harmful habits can dramatically improve digestive health. Now let's consolidate everything into practical daily actions you can start immediately. First, observe your stool and track it daily. Second, stay hydrated and aim for consistent water intake. Third, eat a fiber-rich diet with plenty of fruits, vegetables, legumes, and whole grains. Fourth, incorporate probiotic and prebiotic foods to support your gut bacteria. Fifth, move your body daily, even if just for 10-20 minutes. Sixth, schedule routine screenings and never delay reporting abnormal findings to your doctor. Seventh, reduce processed foods, sugar, and harmful lifestyle habits, and manage stress effectively. By implementing these steps consistently, you create a preventive framework that protects your digestive system, overall health, and longevity. The most important point I want to leave you with is this: your body communicates constantly. Stool is one of its most reliable indicators, but it's often overlooked because it's considered uncomfortable or embarrassing to discuss. By learning to observe, record, and understand these signals, you equip yourself with knowledge that can prevent serious disease. Detect problems early and allow you to take control of your health. Don't ignore these signals thinking they are trivial. They are your body's way of giving you advance notice. Acting early saves lives, prevents suffering, and allows you to maintain a higher quality of life for years to come. Every simple habit you adopt, tracking your bowel movements, maintaining hydration, eating a gut-friendly diet, exercising daily, taking care of your gut bacteria, and staying proactive with medical care, compounds over time. These actions build resilience in your digestive system and provide an early warning system for more serious conditions. When you start seeing the results, more regular bowel movements, better digestion, improved energy, and even better mood, you'll understand the incredible impact of what may seem like small changes. This is the essence of preventive medicine: identifying risks early and making actionable choices to avert serious consequences before they occur. Remember, Black stool, repeated bright red blood, pencil-thin stool, constipation lasting more than 2 weeks, diarrhea for more than 4 weeks, or any sudden persistent change is a signal to act immediately. Never wait, never hope it will pass, and never feel embarrassed. These are critical red flag symptoms that require medical attention. When you speak with your doctor, being specific and providing a record of your observations empowers them to act quickly, which could make the difference between life and death. As you adopt these practices, involve your family, especially children and grandchildren, in understanding healthy habits. Encourage them to eat real food, maintain hydration, stay active, and recognize the importance of gut health. By doing so, you are not only protecting your own health, but also creating a culture of wellness for the people you love. This awareness and early intervention can prevent unnecessary suffering, improve quality of life, and significantly extend lifespan. In conclusion, your bowel movements are a daily conversation your body is trying to have with you. You have the power to listen, understand, and act by paying attention to color, consistency, frequency, and changes. By maintaining a diet that nourishes your gut, keeping active, supporting beneficial bacteria, staying hydrated, and following up with medical professionals, you give yourself the best chance to prevent serious disease and maintain optimal health. Don't wait for a crisis to force action. Start today and make these habits an integral part of your life. Your health, your family, and your future depend on it. Take control now because your body has been talking to you all along, and now is the time to listen.